We start this half hour with the rise in respiratory illnesses in Michigan. Thank you for staying with us. I'm Mike Duffy.
And I'm Carolyn Clifford. The state's most recent report has respiratory illnesses spiking from moderate to high within a matter of a week. Washtenaw County reporting its first flu-related death. Well, today, doctors at Corewell Health sounding the alarm for the rising numbers and saying that people need to prioritize when is a good time to go to the emergency room or to the doctor's office.
I would say that if things are getting worse, where you're having a persistent fever, 101 degrees Fahrenheit or higher, and it's persistently staying high, those are the sorts of things where you might want to start reaching out to your primary care doctor if you have one.
Our chief health editor, Dr. Partha Nandi, joins us now. Dr. Nandi, when could this flu season, COVID cases actually peak?
Everybody's asking, right? The never-ending question, right? Right now, both flu and COVID-19 are surging, and I've noticed that many folks, including patients and friends, have become sick with either one. As for when the cases might plateau, there is no clear peak in sight at the moment. You know, traditionally the flu tends to peak sometimes midwinter, usually between December and February. However, it did get a later start this season, Mike, so it could run into the spring. Unlike the flu, COVID-19 technically does not have an official season, right, since it causes disease all year round. But generally, we see more cases, hospitalizations, and unfortunately deaths from November through April with higher rates during winter months. Now, let's talk about flu levels. Most states are reporting high or very high levels. According to the CDC, at least 10 million, that's right, 10 million illnesses have occurred since the start of October. Over 20,000 people were hospitalized for the flu in the week ending December 30th. And there's been 6,500 deaths from the flu, including the Michigan resident who passed away in Washtenaw County. That adult was reported to be older with underlying high-risk conditions. Now, turning to COVID, the number of cases is higher than last season's peak, but hospitalizations and deaths are lower than in past seasons. That said, more folks are ending up in the hospital due to COVID-19 compared to the flu, with over 34,700 hospitalizations reported for the week ending December 30th.
It certainly seems like a lot. Should people be masking up again?
Yeah, important question, right? So I recommend still that we mask N95, KN95, KF94 masks offer the best protection, while cloth masks, I feel, are less effective. It's important that your mask fits well. That's important, and it's worn correctly, and I highly recommend that you wear them in crowded indoor areas. Also, before heading out the door, it's a good idea to look up your county's respiratory virus trends on the CDC's website to see how high the activity is near you. And besides masking, important, vaccination is super critical at this time. Most reported flu cases to date are influenza A strains, with occasional cases of influenza B reported. And this season's flu shot is reported to be well matched, so that's good news. As for COVID-19, the vaccine still provides some protection against the newest variant, JN1. Remember, vaccines are recommended for anyone 6 months and older, and it's really important for people age 60 and up to get vaccinated, as they most likely are likely to fall severely ill. There is still time to get the shots to help protect yourself and your loved ones. And we were talking about this before we started this segment, that people think it's nothing and there are folks dying. That's the important thing. And even if you feel like you're protected, the elderly person next to you or the immunocompromised person next to you may be affected and die. So,
okay, great reminders. Thanks, Dr. Nandi.
My pleasure,
Appreciate
of course.
You. And if you have a health question for Dr. Nandi, you can email him at drnandi@askdrnandi.com or send it to us on Facebook or Twitter. Carolyn?
Such great information. Thanks, Mike.